for the first time. So Richard will get to you shortly for an update, and you'll get to listen to everybody else. Some folks already know you, but some folks do not. So anticipate learning some things from you with your sharing. So, okay, Lisa, with that, why don't we start with you, and then we'll move into health updates pretty quickly after that.
Okay, well, good morning, everyone. Thanks for allowing me to share. I just have a couple of things I wanted to talk about briefly. One is that we are averaging, at least the last month, probably between 20 and 25 calls a week, if not more, from folks that are homeless that are looking for permanent housing. And you all know the struggles that we've got with lack of resources in our community. So we're doing our very best to connect those folks to people that can, and organizations that can, get them moved forward. So we're, just doing the very best we can. And what we're seeing a lot of in the last month are folks that don't have any ties here, no family, no friends, that are just moving here. And so I'm not really sure what's up with that. We've always had our fair share of that as a community, but it seems like we're getting more of that in the last month or so. So we're trying to gather information on why they're coming here, but a lot of times they just say, we just need to get out of where we were and want a fresh start kind of thing. We have one homeless person in quarantine right now. And as most of you all know, we are unable to quarantine them usually right in our own community. So, which makes providing all the resources, the meals, and, all that transportation, everything a little bit more challenging. But so far, we had one couple that just got out of quarantine last week, and another person that went in 2 days ago. So I'm really hoping that doesn't continue to increase. But with those numbers going up, I would anticipate it probably will. So that's really all I have, Margaret. A lot of other things going on, but that's really everything today. Does anybody have any questions? Okay, that was easy, wasn't it? Well, thank you guys. And I'm sorry I have to jump off here. Most of you have my email if you have any questions or anything. I'm kind of on call this weekend with the big fundraiser we have going on. So I will have my cell if you need me. But thanks for all that you all do. I appreciate you.
Don't go out yet, just in case you haven't. Brian Plank's update, he emailed. And he said that, and some of this you may know all of it. Anyway, they've had positive COVID cases, so they've been trying to manage those and really put all their restrictions back in. That's with Haven Arrest. And they feel like they're containing it to hopefully a greater extent. There's no sharing Christ this weekend because of Rhythm and Roots, but they will be, and normally they don't serve on Saturday nights, but they will be serving this Saturday night from 5 to 6. So just want to be sure y'all know that, Lisa, if you didn't already. So
yeah, we helped make those arrangements. So, but thank
fantastic.
You. Yeah,
fantastic. Fantastic. Is there anything else along those lines that you can think of in addition, or no?
No, not that I'm aware of.
Okay. Yeah, we know that Rhythm and Roots does do some upsetting with some of our services and schedules and everything. So anyway, okay.
But if you all need me, just reach out, okay?
Thank you.
Thank you. Thank you so much.
All right. So if you want, we'll go ahead and do some health department updates. And Mariah, would you like to go first? And I've got an update from Mayor Malin Luttrell from the Sullivan County Health Department.
Yeah, of course. So as y'all probably know, it has been crazy at the health departments. There's been a huge uptick in cases. We're averaging over 100 cases a day. So we're staying really busy. A lot of us had to shift from our regular job duties to help with the surge in case investigating. But I do have other couple updates. We are having a mobile vaccine clinic at the manufacturing job fair in Withville, and that is on the 16th. It's from 9 a.m. to 12 p.m. So anyone can come and get their vaccine. I also still have tons of reusable masks if any organizations need any just to hand out. I also just got a new shipment of some really good outreach materials. We have posters, we have postcards, if anyone is interested in those to hang up in their offices. We also have some really cool window clings that has a QR code on it that anyone can scan, and it takes you to the website and lets you know where vaccines are available. And the last thing I have, if anyone you know is still needing their vaccine, just advise them to call their local health department to get vaccinated. But other than that, that's all I have for today.
Thank you very much. For Sullivan County, they said between Ballard's footprint and health department, they're performing about 2,700 tests daily, and positivity rate is about 20%. And most of our surrounding areas are about the same. The inpatient this morning for Ballard is at 398 with 105 in the ICU, 72 on vents, 93%, and we see those dashboards, 93% of the hospitalizations are unvaccinated. Approximately 350 patients being monitored and treated under the Safe at Home program. 8 pediatric cases with 3 on vents. And they have administered treatment with the antibodies to approximately 1,500 patients across their footprint with good success. And Ballard has a surge plan to accommodate 515 COVID patients at this point. The Sullivan County Health Department has a plan to start the booster shot by September 21st if they're given the green light. So that's the status of, that was a wave at you, Tina, I think. That is, thank you, Mariah, for putting that information in the chat. So yeah, that's where Sullivan County is. Does anybody have any other health information they want to add to that for Tennessee or Virginia? If not, we can move back to our list. And Arch, I don't think anybody's here. People Incorporated, I don't think anybody's here. Does anybody have updates from either of those organizations? Sometimes we do. Arch, we do. Sorry, Ann. I forget. That's so exciting. So glad to have you, Ann.
Thank you. We are working remotely from the Johnson City crew, or anyway, and just continuing to do that. Luckily, we have all the setup to do that. So keeping real busy still, and with all the challenges. I think Doug is still going in the office Monday through Thursday. So he's still doing some outreach and with a few people. So anyway, it hasn't slowed down any. It's just kind of scary. But I don't have anything real major to report. We're just carrying on.
So Dottie Havlick raised the question for Family Promise, and some of the rest of you all will probably, it's part of it, whether the new presidential mandate applies to some of us who have federal grants for vaccination status. So I know Family Promise, we're trying to find out through Ann Cooper whether we count as federal contractors. Also anticipating it may be challenged, so we may not need to determine that right off the bat, but trying to figure out, do we follow that federal mandate? So that'll be interesting to see where that falls with more information.
Yes, it will. New ball game.
Right. Yep. So interesting stuff. So, okay, thank you, Ann, for giving that. Frontier Health, Highlands Community Services, I don't think anybody's here. Next on our list is, I think Christina just joined. I could start with Ellen while Christina gets settled. Ellen, what kind of updates do you have from City of Bristol, Virginia?
I really don't have any updates. City Hall is requiring masks. Still, they started that a week or two ago. You know, everybody needs to be masked up. Other than that, I don't have anything new.
Okay. All right, Christina. Oh, you were here earlier. I forgot you joined before we started. Go ahead.
Yeah, sorry. Anyway, it's been crazy in the office today. So our caper is up online for people to view, and the caper is had acronym for Annual Consolidated Evaluation Performance Report, blah, blah, blah. Anyways, if you guys want to see what we did in the last year, it's up on bristoltn.org. There is a report at the library, here at the Development Services Office, at the Annex. There'll one at Slater Center, and there will be one at Bristol Housing first of the week. So anyways, we had a busy year, and it does also include some of our COVID funds, a little bit of information on that. That's all I have.
Okay. All right. Does anybody have any questions from our city folks? If not, we'll go ahead with our schools, and Kay Ward was unable to be here, and she had several things to say. She wanted to thank the community for their Family Resource Center school supply drive for the flood victims, and in Humphreys County Schools. Bristol, Tennessee sent 15 boxes of construction paper and number 2 pencils to Middle Tennessee. And then they continue to follow significant COVID spread protocols. All individuals will be required to wear a face mask indoors in all of BTCS facilities during this period of time, with the exception of those who have opted out. Guardians or parents who have opted out. As y'all are probably aware, Governor Lee said that had to be part of any mask mandates. I have not heard the percentage. I know in Johnson City schools it was about 25%, who maybe a little higher than that, who had opted out. And then beginning Monday, BTCS is going to be offering opportunity for COVID testing for the staff and students, and they've got information on their website. In addition, they've got a vaccination clinic on September 18th, scheduled from 10 to 1 at Tennessee High School. So if we publicize that along with everybody else's vaccination opportunities, that would be great. So hoping that as people are seeing their loved ones get sick, that if they have not vaccinated, they will determine it's a good idea. So, okay. And let's see, other housing. I don't think we have anybody from Tennessee or Virginia housing authorities. We do have
Excuse me.
Lynn.
Yes.
Oh yeah, I'm sorry. You're in Vision Center, Lynn. Okay, talk
okay.
about housing in both places. I'm not doing too well. I skipped over Ann. I'm skipping over you. Go ahead.
Yeah, that's okay. I will say for the schools too that Kevin issued a update for Bristol, Virginia City Schools, and they're going to be vaccinating tonight at the ball game, and those who get the vaccination get in the ball game free. I thought that was great. So, and kind of out of the box thinking. So they're doing that. They're going to be temperature checks in the car rider line before people go into the schools and that kind of thing. So they're kind of up in their game as far as the COVID mitigation kind of thing.
And they already require masks, right?
Yes,
They've done
yes.
that from the time they came back, right?
Mm-hmm.
Yep.
Yeah, because we have a different governor, and he said that it shall be, and so it shall. So there we go. But anyway, they're trying really hard. And I think Bristol, Virginia schools did a lot of in-person, tried really hard to keep the kids in school. And they're trying everything they can do to keep kids in the classroom. So that's important. Housing, the eviction moratorium, the on again, off again eviction moratorium is enough to make a person dizzy, right? And whether federally it's on again or off again does not matter in Virginia, because our governor has implemented eviction protection, which for all intents and purposes is an eviction moratorium. It is virtually the same thing. The protections are there on behalf of the tenant. And at the Envision Center, we are continuing to offer the service of helping landlords to access the rental relief money that's available through the state. We have done, oh goodness, probably, I can't even remember how many we have done, but I know that we got 4 more approvals this week. And so we have helped quite a lot of landlords to access that money on behalf of their tenants. And the money goes to the landlord. It does not go to the tenant. So the debt is paid, and the landlords are appreciative because, they really are the ones who have been shortchanged through all of this. So we're happy to help them. At the Housing Authority, we have a staff person dedicated to helping to recoup some of the money for folks who are behind in their rent. And as to date, I think we have recouped about $65,000 in unpaid rental assistance through money with the state. So of course, it's federal money that funnels down through the state, but happy that we can help folks to do that. The state money is very generous, and it will even pay ahead if it pays so much behind, but it will pay 3 months ahead as well. So there's a lot of money out there, and people are not afraid to help. So if you know of people that are behind, if you will tell them to contact the Envision Center, I'll put the phone number in the chat, then we are happy to help them to access those funds. And then we also have money through the city partnership with the city of Bristol, Virginia. So we have money to help with rental or mortgage arrears. Very definitely. Now, I will say the state is very generous in their idea and identification of COVID related. With the city, we need to see a very direct cause, right? We need to see that COVID is directly responsible for your predicament. So, and we will document that. The city has been, the state money is very, very broad when it comes to that, thinking that everybody somehow or another has been affected by COVID. So there's help for everybody. And we're helping folks, and money is coming in, so that's great. We've also been helping and staffing the homeless cases a lot that have been referred to as the calls that come into United Way, calls that come into People Inc. And so we've been helping to connect people to services and applications for housing and one thing and another. So I'm trying so much to help provide services for those who are currently experiencing homelessness. So. And right now, I will say, as exciting as it is to have Rhythm and Roots in town and the race, we have people who are uprooted from the hotels currently because they had rooms there that the business of the hotel needs their room back. So, I understand hotels too, right? So they jack up the prices and they fill those rooms, and that creates another layer of insecurity and difficulty for us. So anyway, but we're working on all that. Doing great stuff.
Thank you, Lynn. And can you put the telephone number in the chat?
Yep, I'm glad to.
That'd be great. And I'm going to move ahead to Dottie. Are you ready to talk about Family Promise, since that follows well on some Tennessee opportunities as well?
Sure. We're doing pretty much the same thing. We have our grant is homeless prevention. And so we serve people with back rent who have not yet been evicted. They're not living on the street. We do get calls from those people, and we connect them with Arch in Johnson City, who has the funds for rapid rehousing and people who are actually already homeless. So our grant from HUD through Tennessee Housing Development Agency through Arch, little trickle down, we are helping people As Lynn said, we're getting a lot of calls. I mean, our first, we did not start our program until June, seeing clients, because the way Tennessee distributed its funds. So we got, I think, 25 calls the first month, and now we're getting over 250 calls a month. And our assistance was just a few $100s the first month, and now our last two reimbursements that we submitted were over $50,000 that we are giving out to people. Our grant is for Sullivan County, Tennessee, and so we have been working with those areas. And if you know anybody who needs assistance for their back rent, we provide and utilities and some other expenses. They can call Family Promise, and we are there to help them. We have an intake person 5 days a week, and we get back to people as soon as we can. Within a day. Because now then a case manager is assigned to those people. We have two full-time case managers, and so we are moving. We have people people in motels because they were self-pay in the motel, and then they ran out of funds, and they can come to us for help in that regard. Or if they are staying with a relative and the relative asks them to leave, we can help them find new housing. So we do have, we don't have as many motels in Bristol, Tennessee as they have in Bristol, Virginia, but we do have some rooms reserved even during Rhythm and Roots and the race. Our partner, the Days Inn, has reserved rooms for us, and we just have to pay a little bit more money for them than we do normally. So we're glad that our residents there are not going to have to be moved to the street or find other accommodations during that 10-day period, that the weekend of Rhythm and Roots and then the weekend of the race. So we try to accommodate. We have a small waiting list, but not a large one. We're moving some people off our waiting list onto now that we've got two case managers, and one of our case managers did get COVID. He was vaccinated, but his daughter got sick from school, and then he was sick for a week. But that kind of slowed us down because our new case manager was just starting the week that week that Sam was out, and so his training was delayed a little bit. But we're moving now back onto full speed ahead, and we really want to help with rent. So thank you, Margaret, to put the Family Promise phone number in the
Oh, it's wrong. It's 528.
Okay,
So I'll correct it.
thanks, Margaret, for putting the wrong phone number.
Really, I'm having trouble.
But
I am not Melissa, okay?
no, and I can't type into my laptop either. So, anyway, they can call us. If we can't help them, we will refer them and work to help them get assistance somewhere else, especially if they're actually homeless already. Our funds will not cover them. So we will actually help them. And our case manager has worked with people like that to get them where they need to go.
Okay. Also, we were asked a while back by Lynn Pinnell to put together a presentation for Bristol Coalition, and we are working on that. So we may present that to this group too, that tries to put in writing visual what the grant does and what it doesn't do, et cetera.
Yeah, it's a lot of people work in Virginia, and their grant is administered differently from our grant, and people are always asking us, what do you people do? And because we've only been doing it since June, that's an understandable thing. So yeah, we're getting together a PowerPoint, and we will be distributing it to people who keeps asking us what we do, because we want everybody to know what we do and how we can help, so that they can refer people to us.
Okay, thank you. Okay, and Andy for Optima Health, are you still on? Is Andy Strader? Yes.
Hey, good morning. So open enrollment for CCC Plus is coming up starting October the 1st. So if you know of anybody that needs to make a change or is having difficulties with doctor's appointments, that sort of thing. So for Virginia Medicaid, individuals that are on the CCC Plus, that's the age-blind, disabled, the dual enrolled individuals. Also, the dental plan is up and running for everybody in the Medicaid realm in Virginia. And I'll put a link to that in the chat. It has good information on finding providers, as well as other information on what's covered, what's not covered, that sort of thing. That's all I've got.
So Andy, do you know, is there data yet to share for what's happened since Medicaid has been expanded in Virginia, for how many people have been covered, and if we're seeing any difference? And it's a little early for health status to show a difference, but whether there's somewhere that's being tracked to share, do you know?
I do. I'll put that in the chat as well. On the DMAS website, they have a tracker that shows how many people are covered in per county, and gives enrollment numbers and shows, from year to date, gives a good breakdown on that for all health plans.
Also, I know I've seen presentations in the past that expansion of Medicaid improves people's financial status overall, not just with health, but because they have that health coverage and don't have as many medical bills, that it improves financial status overall, which improves the status of the state. So it's an interesting data point to give for reasons to expand Medicaid. And we know, particularly in our area, dental is bigger than medical for what the needs are. So it'll be interesting to see what happens with the dental in Virginia, and in Tennessee, we're jealous. So of both those things. So anyway, okay, that'd be great. Put it in there. We'll look forward to looking it up and seeing some information.
Okay.
Okay. Okay. I think some folks that are here, let me give, Sandy Hendricks from Ballad Health Workers. Why don't you give a little bit of an update?
I don't really have anything for our program. We have 6 community health workers working in the region now, and we're hiring more. If you know anybody with a heart to serve, they're also hiring at the hospital, just for just about every single position. They're encouraging everybody to get vaccinated that can, and y'all just stay safe. Thanks for all y'all are doing. That's all I got.
Okay, and we appreciate all of y'all being able to refer people to y'all and receive referrals when y'all are meeting the needs with folks. So okay, so Amy Little, I was going to get to you next. So, and you're putting stuff in chat. Are you able to speak? I know you've got bad voice breakup today. Do you want to say hey and tell us to look at the chat, or what's your status?
you could just look at the chat.
Okay. Okay. We appreciate your being here and sharing with, oh, you got it. So we don't know how much is in COVID is in our jails. And we do know, so, okay. So there's a big jump in the number of folks who are there. And I'm sure y'all are aware that Sullivan County Jail is very overcrowded, was before COVID, and that makes it a hazard for folks to be there. So, and Amy works for Sullivan County Anti-Drug Coalition, great enthusiastic person to advocate for addiction services. So we thank you very much, Amy, for what you do and for being here today. So want to welcome Richard Keene, who I think this is your first time at one of these meetings. So if you want to tell us what you do and if you have some information to share, that would be great.
Okay, I know a few people on here and some I don't, but I work for the state of Virginia in vocational services. It's the Department for Aging and Rehabilitative Services, and I work in the Division of Rehabilitative Services, and we work with people that have disabilities or barriers or impediments to employment, and they are looking to go to work. We look at three main areas. I'll give you just a quick rundown for anybody that doesn't know, but just a quick summary is that we work with people that have physical barriers they were born with or acquired through accident or injury or health condition, something that makes it harder physically for them to do certain jobs as other people. And then if you look at the medical or health conditions that may be just acquired for whatever reason. I mean, if someone's has severe asthma, or if there's a severe diabetic, person, that is somebody that couldn't do certain types of jobs that others could. We also look at cognitive, anything to do with the person's ability to process information, whether that be ADHD, and we're talking significant, active diagnosis. If someone has ADHD or learning disabilities or a brain injury or something like that, that it makes it harder for them to seek and obtain employment or maintain employment. We try to work with them on getting into work or maintaining that job, and apologize. And also then on the emotional side, we work with people that have, an active ongoing mental health diagnosis, something that's more, and I want to say stable and ongoing for a long time, not just a situational, maybe diagnosis. So, and under that, we also work with substance use disorder. So I myself, my particular position, I work with the substance use disorder and mental health diagnosis and get referrals from multiple different agencies and organizations in Bristol. I work Bristol City, Washington County, and Smith County. So, and again, the goal is to work with them on employment. And like I said, someone doesn't have to have a formal disability if they do receive SSI or SSDI. We are actually the largest employment network to work with Ticket to Work, and we can help guide them and help them understand how much they can work and earn and still maintain their SSI or SSDI. They have that right. Or if someone wants to explore going back to work full time, we can help them understand how that works and the protections they have and how that works. Work with a lot of folks that are not, formally considered to be disabled, but they do have barriers. And again, working with the substance use disorder programs and the local CSBs and various programs to help them to get back into employment and a lot of the reentry stuff. So, and then we have counselors that go into schools and work with the high school students, work with the students that have IEPs, and they're going to be seeking employment after high school. The whole goal there is to help them be more successful after high school to work versus not work, or maybe just end up in entry-level jobs for multiple years. So the goal would be to try to help them get into some type of career path that would give them more opportunities and be able to help them be more independent. We have general adult caseload counselors that work with people that have, we've worked with people that are paraplegic, or maybe they have some type of manual dexterity issue, or they have some, something of that nature. And it's prevented them from being able to be as gainfully employed as someone else. So you can think about that, and if someone believes that they may have someone that would possibly benefit if they want to go to work. That's the main criteria. They want to go to work and they believe they have active ongoing diagnosis and barriers to work. And in just a minute, I'll put in the chat our main office number, and you could just give them that number and they can call and do a self-referral, or someone can call and do a referral, or if somebody wants to just reach out to me, I can help them as well. And then we'll determine our office breaks up our territories by what type of barrier that someone has, and each county. So each county may have someone that works with different types of barriers. So, but if you get the referral in or someone calls in, we'll make sure it gets to the right person to work with them. For example, myself, I work with substance use disorder and mental health. So, but right now we do not have a delay for services. At times when, at different times in the past, we've had maybe a short delay for services because we may have too many people applying at the same time, and you've got, of course, manage the funding. But right now we have all of our categories open, and categories being just the 3 different levels of severity of disabilities. And what the federal regulations state is that if funding becomes more tight, then we start to work with those that have more significant disabilities and barriers to work. And so we have all categories open, and we're just doing what we can to help people and support them as they start to look for employment. So, but thank you for your time. I've been in this group once a couple of months ago, and then I wasn't able to kind of be in last month. So thank you. I appreciate you continuing to send me the links, and I'm going to start trying to join in each month.
Great, thank you.
Right.
So, okay, Tiffany, if you want to give us some veteran information update, that'd be great. If you're available, great.
I am sorry, I was trying to unmute. Yes, I don't have a huge update today. There is the domiciliary has sort of here at the VA Medical Center, that's our homeless treatment program, and they have substance abuse and mental health as well. They are still trying to get down to a single bed occupancy for COVID, just for precautions. And so they are still doing interviews for that program, but they're a little bit delayed on taking people in. So if you have a veteran that's seeking treatment, it may be a little bit delayed. Also, we're still accepting referrals for all of our other programs, the Grant Per Diem and the HUD VASH. I can't think of any other updates. Only last time that we met, I introduced our new outreach worker, Chelsea, but I got busy or something in my head and just forgot to give her a chance to speak. And so I wanted to see if she wanted to introduce herself better, because I just sort of said her name and then moved on or something. So I apologize to you all and to Chelsea, but she is on here now. So I'll let her talk.
Hello. I don't really know what to say. So thanks, Tiffany. But yeah, I've been at the VA now for about, I guess, 2 months now. So I'm still just trying to get my feet wet, but I am the outreach worker for the homeless programs. So it's good to meet you all, and we'll probably, I've put myself on these meetings as well to try to attend them and, hopefully work with you guys and partner with you as well.
Great. And if you can put your info in the chat, if you haven't already, that would be awesome.
I sure will. Yes.
Great. Okay. Thank you very much.
Thank you.
It looks like there's, I don't see anyone here today from our faith community. We usually have a couple of folks, but I don't see anybody. But we have Bristol's Promise, Melissa, Brandy, and Tina McDaniel. So Melissa, do you want to introduce Tina, and then all of y'all can give whatever updates?
Sure, absolutely. Thank you, Margaret. So Tina McDaniel's famous now. She was in the newspaper yesterday. I don't know what else needs to be said. Tina McDaniel's joined our team on September 2nd as the very first diversity, equity, and inclusion coordinator for Bristol's Promise. So we're super excited to have her join our team. We've been doing some onboarding work since she joined us, but she is getting ready to spread those wings and fly, and I'm sure she'll be reaching out to some of you. Tina, do you want to give a little, hey, hello, this is who I am?
Well, good morning. I'm happy to be a part of Bristol's Promise. I'm really excited and passionate about the work around diversity, equity, and inclusion and how that intersects with all of the work that you do. So I'm very excited to be here. And thank you, Melissa, for the introduction.
Yeah. So other things that we're working on, I think have already mostly been covered. We've been working with the Bristol, Tennessee Housing Authority. There's not enough housing. We know that. Our housing stock is low. And so we're connecting Family Promise with some of the Section 8 folks, trying to come up with a resource list. Just continuing to support people where they are. We're seeing an increase in need and in reaching out for services. We work directly with frontline workers on site at businesses, and we're seeing an increase in people reaching out to our community resource navigator, Brandy Peters. And she's working hard outside of regular hours to make sure that people are supported and connected with resources in our community. Brandy, do you have anything to add?
Sorry, I'm working on I'm doing some case management at the moment, actually. But no, my increase at businesses, at partner agencies, my traffic has increased a ton. And now businesses are calling saying, hey, I need you to come at a different day because I've got some crisis management that needs to be done. And so I've been dealing with that this week. It's good that there's somebody there to help them, right? I'm very thankful that I'm there. Just not used to as much traffic as I've been seeing, but we just know there's a lot of need, guys.
Yeah,
there's a lot of need in our community. So
yeah, so we appreciate all the work that everybody around this screen and people who couldn't make it are doing, because you all really are helping support community and the folks that we see as well. So that's all I have.
Melissa, why don't you share the trauma-informed community, trauma-responsive community, just any update, and invite anybody to attend. We certainly, with all the work that we do, we need to always keep that in front of us to remember.
So we do hold and trust the Trauma Responsive Care Community Network for Northeast Tennessee. We coordinate with the Southwest Virginia one that's hosted by United Way of Southwest Virginia to make sure that we are crossing those state lines and nobody's getting left out. October is ACEs, which is Adverse Childhood Experiences. October is ACEs Awareness Month, and so we're doing some planning and some work around that, and we'll be premiering an online community that will allow our group to move forward. So our next meeting will be on October the 28th at 10 a.m. It will be via Zoom. So if you're interested in joining that group, I encourage you to visit our website and get signed up for our newsletter. And if you have any upcoming events or things that you want to share with the community, I also encourage you to reach out, and we can put those on our community calendar.
Thank you. And Samantha Gray is not here. She works with parenting, both some direct parenting programming as well as works with the Parenting Educators Network. They meet on a regular basis, and I believe it's third Thursday at 12. So that would be September 16th. It also is via Zoom, so convenient for folks to join. So you can look for that on our website as well as in the calendar as well. Our Youth Networking Alliance that's been meeting since 1999. Every September, we are having as a habit to have an update from our schools, the Bristol, Virginia City Schools and the Bristol, Tennessee City Schools. That meeting is going to be September 30th. We had hoped to and had reserved the Bristol, Virginia School Board office. We are not going to be in person. We will be on Zoom again for that. That meeting can also be found on our calendar, and it goes out in our newsletter as well. So we enjoy hearing, and hopefully we'll get something a little bit beyond our COVID emergencies right now, which we know is what's critical right in front of us. But I know school systems have a lot of things going on in addition to that hopefully we will get to hear about. And I think, does anybody else have anything else that they would like to add? If not, our next meeting, if we continue every other week, would be the 24th. We may maybe have that meeting. In the past, we try to do surveys to see frequency of meetings. We had dropped back a little bit in July and August, but with the Delta variant, and the numbers, we came back to a more frequent every other week. So at this point, that's what we're planning on, is on the 24th. And we will be evaluating, though, to see if that's too frequently, if we want to spread out with everybody's busy schedules. So appreciate everybody. I know everybody on here has been operating pretty much in a crisis mode since March of 2020. It hadn't stopped. It's exhausting. Somebody I heard describe the healthcare folks, their emotions as pulverized. I think that's pretty strong word and pretty accurate for this is just exhausting. So we appreciate everybody. Reach out if there are things that we can do as a group, or if you see resources or just support from anybody who works in these fields. So appreciate y'all very much, and we'll see you again in a couple of weeks. Let us know anything in between. We don't do BCC, so that if you do have anything major, you can reply to all. You can also send stuff to me, and I can send it out to to the whole group with several announcements together, in addition to posting on our website. So thank y'all very much. Appreciate you. Take care. Bye-bye.
Bye-bye.
Thank you.